Now close halfway. Close halfway. Put the jaw to the left. Yes, like that.
Keep your eyes closed to the light and shine on it.
Yes. And then you see that last tooth right here, you guys? That's the wisdom tooth. The last tooth.
I know.
You can close a little bit. And then I usually love say that you okay? Any pain. Now, what I do that I want to make sure the patient in pain or not. Are you in pain? Good. You
I know, I'm in pain watching.
close halfway, relax, and move the jaw to the left. Now what I did, I just rock it out. You can release my finger there. I need my finger. Okay. And then put the chin up. Put the chin up. She have a petite mouth. Her tooth is very petite. Okay. You see that? And then okay. Put suction. Suction.
It looks so easy.
Now you know why that sometimes I do 4 or 5 extractions in 10 minutes. Okay. Okay. Now what I did you happy? Okay. You want to see it? No, later? Later? Okay, okay, later. But I know the two looks very cute. Very cute. It is a boy. Okay. Now open like that. And if you later on I pass it on the tooth so you have an idea. And then I check. Now if you want to see what it would look like, you see a lot of blood inside. Okay. See that's what we call a socket. Okay. And then this is it right here.
And that's the wisdom tooth?
Yeah, that's a wisdom tooth. Okay.
Kind of looks like a banana.
Look like a banana. Yeah.
They came from the back.
Well, that's the last tooth.
Your boss. Did it
The very
hurt?
last one. You're right.
No.
What?
And-
I didn't feel it.
Okay, now what I do is, you know, you guys notice that you guys have to help me this. Once I remove the tooth, the bleeding start to go, right? That start to flow out. So you have to pass it on right away. She remind me. So I usually, because the last tooth and the teeth is petite, so you fold it like this, you hand it to me, and then I put way in the back. And then bite down, not on my finger. Yeah, bite down like that. Okay, put the lip together. Now, the reason that is just imagine you have a cut on your palm. So how do you stop the bleeding?
Pressure.
Pressure, right? You put this, pressure it. For the longer you put pressure, is better. For extraction, same way. I use the gauze, you guys. I use the gauze. I fold it like this. I make it like this. I put on top of the socket. When you remove the tooth, there's a hole. That's why the tooth is, they call a socket. You push on top of the socket and have the patient bite down on it. This will put pressure against the socket. And then you leave it like that for half an hour. And then in the ideal setting, that's what we do. But in Vietnam, we don't have that kind of time. So what we do is we have them bite down, maybe 5 minutes, 7 minutes. We make sure that they stop bleeding almost like 60%, 70%. And then we send them away and then we instruct them. After every half an hour, you have to check. And then we show them how to put the gauze in the mouth. So I usually explain it to the patient. After half an hour, you take out your gauze yourself. You look in the mirror if there's still any bleeding. If you're bleeding, you put you make a gauze like this, and then you push in. You buy another half an hour. You keep changing the gauze until the bleeding stops. How often? How long it stops? Usually less than, I would say, less than 2 hours. If 2 hours later and you're still bleeding, that means that you didn't put pressure enough. So you increase the thickness. So, and then another way to stop the bleeding is using the tea bag. And then you put the tea bag and then bite down on it. The ingredient of the tea does control the bleeding. Okay? So, and then things that you tell the patient, that also instruction on the piece of paper in Vietnamese, things that you should not do for the next 12 hours, meaning that the next 12 hours, no spitting, no rinsing, Because spitting, rinsing cause what? More bleeding. Okay, so what that means? That means can she brush her teeth tonight? The answer is no, because when you brush your teeth, you rinse and spit. You cause more bleeding. So you don't brush your teeth until tomorrow morning. Okay? So during the time when she bite down the gauze, can she swallow? Yes, she can swallow. Okay, you can swallow that. It's not blood, it's just saliva. Okay? Then you bite down, and then but I'm going to change the gauze for you to make sure that the bleeding stops. Okay? So anyway, so you notice that everything that I touch, I isolate in one area, right? Just imagine she's infectious. So I don't touch here, I don't touch here, I don't touch here, I don't touch here. I touch only the mouth, my glove, here, and that. And sometimes Kelly doesn't let me touch that. She do it for me. Why? Because so that's one thing that you have to clean. Okay? So you try to help me out so I don't have to spread things out. Okay. Now another thing too, I forget about that too. No, you don't smoke, right? Because no smoking, because Vietnamese people, they smoke like crazy. So no smoking after like next 12 hours, no smoke, at least 6 hours. Some people, they cannot wait 12 hours. The moment they're done, they go out and smoke right away. The smoking or any suction device like a straw or smoking cause more bleeding. Okay, so I tell them do not spit or rinse, smoking or using the straw, okay, until 12 hours later. Meaning no rinsing, no spitting, and no brushing the teeth at the same night. Okay, remember that. I'm going to ask a question. Very important, okay? So what is the fourth thing that you should not do? And spitting. Okay, so that means that you have to explain to us, that means no brushing the teeth tonight. Because they say, okay, I understand, and then they go home, they brush. So what they do is they brush, they rinse, and they spit. They didn't realize that, okay? And then, you okay? You can pick that up. Yeah. You can turn off that so she's not too much glare in the eyes.
White.
Yeah, like that. You okay? Can you give Catherine a hand? She's so good. Thank you so much, Catherine. I think that she, tell the truth, not all the patients like her. So she's very calm. She's a perfect model for this. Okay, she's very calm.